Zang, The Organ System of Traditional Chinese Medicine by Jeremy Ross. Page 201. Disharmonies of three or more Zang together. Only a few of the common combination of three or more Zang will be considered, since this section quickly develops into the next stage, the study of common disease patterns. The basis of the groups of three or more Zang together is the division into deficient yin and deficient yang. Deficient yin group. Any combination of deficient Shen, Gan, Xin, Fei, and Wei may occur, and the combination of Gan and Xin and Gan and Fei mentioned in the previous section often include Shen. Deficient Yin of Shen, Gan and Xin. Deficient Yin of Shen, Gan and Fei. Deficient Yang group. It's possible to find any combination of deficient Yang of Shen, Pi, Xin, Fei, and Wei. The difference between the deficient yang and the deficient yin list is the former contains P, but not Gan, and the latter contains Gan, but not P. This results from the natures of P and Gan. The former is susceptible to damp and deficient yang, and the latter to dryness and deficient yin. Certain combinations that have already had brief mention are deficient yang of Shen, P and Xin, deficient yang of Shen, P and Fei, deficient yang of Shen, P and Wei, Shen, P and Xin. The combination of deficient yang of Shen and P is likely to accompany such Xin disharmonies as deficient yin yang, Xin yang, stagnant Xin xue, and misting of Xin by cold phlegm. The foundation of the deficient yang of P and Xin is deficient Shen yang. Poor transformation and transportation of P leads to accumulation of phlegm. In conditions of deficient Xin qi and yang, where the circulation of qi and xue in Xin is impaired, phlegm may become involved in the pattern of retardation and stagnation of movement. This may give rise to feelings of stiffness in the chest and lethargy, or, in more severe cases, to speech defects, mental confusion, or loss of consciousness. Shen, Pi, and Fei. These are three main zangfu involved in Gynae metabolism and the cycle of Gynae circulation. If yang, the aspect that warms, activates, transforms, and moves is deficient, then Gynae metabolism and circulation will be defective. If Shen yang is deficient, Shen cannot properly vaporize the fluid and send it up to Fei, nor properly drives the processes of separation, absorption, and transformation of Gynae that occur in Xiaochan, Dachan, and Pangwang. Also, Shen will be unable properly to assist the process of digestion in Pi and Wei, and the dispersing and descending carried out by the yang aspect of Fei Qi. Deficient yang of Pi means improper transformation and transportation of food and drink, tending to result in deficiency of qi and xue, and also an accumulation of turbid Gynae, damp, and perhaps phlegm. Deficient yang of Fei means poor dispersing and descending functions of Fei, so that fluid is not properly moved and sent down to Shen, with resulting edema and perhaps accumulation of phlegm or fluid in Fei. Shen, Pi, and Wei. Deficient yang of Shen may be associated with deficient yang of both Pi and Wei, leading to poor digestion and facilitating invasion by external cold and damp, or accumulation of internal cold and damp, with retention of partly digested food in Wei and the presence of undigested food in the stools. This combination is discussed in greater detail below under digestive problems. Emotional disharmonies. Various groups of combinations are possible here. Indeed, the emotions continually fluctuate and change in the interaction of the involved individual and the environment. However, two commonly occurring groups are Deficient Yin of Shen, Gan and Xin, depression of function of Gan, Xin and Fei. Deficient Yin of Shen, Gan and Xin. This has been listed under the Deficient Yin Group above and is commonly associated with the emotional patterns of anxiety, restlessness, irritability, overexcitability, hypersensitivity, and overreaction to environmental stimuli. It's seen in many patterns of disharmony, including insomnia, hypertension, certain menopausal neurosis, and hyperactivity, and in extreme forms when it has developed in patterns of blazing fire accompanied by flame and wind. It may be part of such diseases as CVA and many forms of insanity. Depression of function of Gan, Xin, and Fei. The relationship of Gan and Fei in this context has already been discussed. Emotions such as melancholy, sadness, and grief are likely to affect Xin as well as Fei, since they will depress the function of Zongqi. Depression of Gan, Xin, and Fei may occur together. If depression of Ganqi is predominant, there may be depression, frustration, anger, and a predominance of Gan signs. If deficient Xinqi predominate, there may be signs of deficient Shen, such as lack of joy, apathy, and mental and emotional dullness. If Fei functions are depressed, there may be weak voice, restricted breathing, and possibly manifestation of grief. In the case of Xin and Gan, moods of depression and introversion may alternate with moods of hyperactivity, excess talking, or outbursts of anger. In extreme cases, there may be fluctuations between violent mania and extreme depression. These alternations may represent fluctuation in the movement of qi and the emotions, associated with temporary obstruction followed by temporary clearing of the blockage before the obstruction builds up again. Alternatively, there may be chronic stagnation of qi and emotions, which eventually and periodically give rise to fire, which blazes upwards. In more extreme cases, for example, obstruction and disturbance of Xin by phlegm, the presence of phlegm obstructing the orifices of Xin senses may result in more severe symptoms. Digestive problems. The main three Zangfu involved in digestive disorders are Pi, Wei, and Gan. In addition, Dang, Xiaochan, and Dachan are involved but are of lesser importance, and Xiaochan and Dachan are generally treated with points from Pi or Wei channels. The interactions between Pi, Wei, and Gan, yin and yang, cold and heat, are summarized in figure 16.6. The basic division in the diagram is into deficient yin and deficient yang. Shen and Wei have patterns of both deficient yin and deficient yang and are therefore at the center of the diagram. Gan tends to deficient yin and not to deficient yang, and Pi tends to deficient yang and not to deficient yin. Thus, deficient yang and Pi, while Shen and Wei may be affected by both external heat and external cold, Gan is predominantly affected by external heat, since it already tends to heat and dryness, and P is predominantly affected by external cold and damp, since it inherently tends to coldness and damp. Gan may also be affected by cold, as stagnation of cold in Ganjin law, and P may have patterns associated with heat. For example, damp heat accumulates in P, but these patterns are not the predominant ones. Wei has patterns of deficient yin and blazing fire, like Gan, but also those of deficient yang and invasion by cold, like Pi. Also, along with Pi, it may be invaded by Gan during depression of Gan Qi, especially if Pi and Wei Qi are deficient. Figure 16.6 also divides people in two types. the yin deficient type and the yang deficient type. Obviously, this is gross generalization, but it is nevertheless a most interesting one. The indeficient type tends to have a thin face and wiry body, with quick, nervous, restless, edgy mannerisms and movements. Such people may be prone to physical, mental, and sexual hyperactivity, irritability, and insomnia. If male, to premature ejaculation, and if female, to premenstrual irritability and menopausal flushing. The yang deficient type tends to be plump of face and body due to accumulation of phlegm, and more placid with slower movement. This type tends to be hypoactivity, dullness, and hypersomnia, with less sexual interest, and if male, tends to be slower to get an erection, and if female, to premenstrual and menopausal depression. In the indeficient type, the pulse tends to be thin and rapid and wiry, with thin red tongue. The yang deficient type tends to have slower, deeper, slippery pulse with fluor, moisture, paler tongue with thicker greasy white coat. One manifestation of the difference between the two types is in appetite for food. The indeficient type will tend to be hungry more frequently with sensation of irritability, lightheadedness, or headaches. This is due to the reciprocal relationship between Gan and Pi, whereby, in this case, an empty stomach represents temporary deficiency of Pi and Wei Qi, so that Gan can more readily invade Pi and Wei. Also, hyperactive Ganyang rises to the head, causing signs of lightheadedness, headache, and irritability. The yang deficient type may eat frequently due to depression or boredom, but does not suffer from feeling of hunger in the same way as the yin deficient type, and is more prone to gain weight, partly since the yang deficiency results in poor transformation and transportation by P, with accumulation of phlegm, and partly since this type of person is usually less active than the yin deficient type. Also, yin deficient people tend to drink larger amount of colder drinks than yang deficient individuals, who prefer lesser volumes of warmer drinks. For example, in a pub, an individual tending to yin deficiency might ask for a pint of cold lager, since yin deficiency tends to be associated with heat and dryness, whereas a yang deficient individual might ask for a whiskey, since yang deficiency tends to cold and damp, so that this type would avoid excess volume and choose a drink that would warm them up. However, although these general tendencies exist and are important in differential diagnosis, the situation in clinical practice is rarely so simple and clear-cut. An individual may manifest signs of both deficient yin and deficient yang simultaneously, or may show deficient yin signs on one occasion and deficient yang signs on another. Or some Zangfu may have patterns of yin deficiency, whilst at the same time other Zangfu in the same individual may have patterns of deficient yang, as described on page 23. Gynaecological and obstetric disorders. Physiology. The three main Zang involved in the physiology and pathology of gynecology and obstetrics are Shen, Pi, and Gan. Shen is directly linked to the uterus and to Chongmai and Wenmai. Pi and Gan communicate with the uterus via the Renmai and Chongmai. Figure 16.7 shows the main relationship involved in menstruation and gestation. This process depends especially on an adequate supply of She, and this depends on the proper functioning of a number of Zangfu and Jinluo. She, Pi, Wei, Xin, Fei, and Shen are involved in various capacities, in the formation of Shui. Gan and Chongmai are concerned with storage of Shui, and Gan and Pi are responsible for holding Shui in Shui Mai. Xin rules the circulation of Shui. Gan is responsible for its smooth and even movement. And Chongmai and Wenmai are also concerned in ensuring that this movement is free and unobstructed, especially in the lower abdomen. Also, if Fei is deficient, Qi may become deficient, and since Qi moves Shui, the circulation of Shui may be weakened. Pathology. The interactions of the Zangfu and the disease factors will now be considered in the origins of gynecological and obstetric disorders. The three main Zangfu involved are Shen, Pi, and Gan. Shen, Deficient Shen Yin and Deficient Shen Yang. The foundation for Deficient Yin or Deficient Yang of the other Zangfu originate as follows. Pi. Just as Shen is the foundation of congenital Qi, Pi is the foundation of acquired Qi in the body. Pi disharmony may originate as follows. Gan. The third Zang involved in gynecological disorders is Gan, which is linked to deficient Shen Yin, just as Pi is linked to deficient Shen Yang. Gan disharmonies have various origins, as shown in figure 16.10 on page 207. Summary. The interrelationship of Shen, Pi, and Gan with the disease factors and the origins of gynecological and obstetric disorders are shown in outline in figure 16.11 on page 208 and discussed in greater details elsewhere. Zangfu interrelationships in some common disease patterns. This section uses the example of some common disease patterns to show the type of interrelationship of Zangfu disharmonies and disease factors in the origins of disease. Hyperthyroidism. Figure 16.12, outlining the origins of hyperthyroidism and the Zang disharmonies and the disease factors involved, clearly shows the inadvisability of equating thyroid diseases with the Sanjiao organ. Impotence. In TCM, there are three main origins of impotence. Excess sex or seminal emission. The result in exhaustion of Shenjin and in depletion of Mingmen and Shenyang. Emotional disturbance. Fright may injure Shenqi and worry, anxiety, excess thinking, and mental strain may injure and depress Shin and Pi. Dump heat diffusing downwards. This is a common origin of urinogenital problems and may be associated with both external and internal dump. External dump may invade the body, or weakness of Shen and Pi may lead to accumulation of internal dump. Dump heat may arise from stagnation of internal dump, especially if mental irritation and frustration lead to Xin fire, which is transmitted down to Xiaoqiang, or to Gan fire, which is transmitted downwards via Gan Jinwo. Since Gan rules the tendons, and since the Gan tendinomuscular channels connect with the genitals, downpouring of dump heat and stagnation of heat in Gan channel may lead to relaxation of muscles and tendons, resulting in impotence. Generally, the commonest origin of impotence is deficient of Shen, but all the other patterns may also be involved. Insomnia. There are 5 main origins of insomnia, which may occur singly or in combinations, depending on the predisposition of the individual and on the prevailing situation. Wei disharmonies. Wei patterns include flaccidity or atrophy of muscles of the limbs, with weakness of impairment of movement. Wei disharmonies involved paralysis only in the sense of flaccidity and weakness, as in polio and myasthenia, and must be distinguished from the painful disharmonies of B, for example, arthritis and rheumatism, and from the patterns of specific spastic hemiparalysis of wind stroke, such as CVA, sequela, and facial paralysis. Wake patterns involve weakness and atrophy of muscles and tendons due to one or more of the throwings. Summary. Chapter 14 considered the basis of Zangfu interrelationships, yin and yang, substances, gene law, and tissues. It looked at the interrelationships between different Zangfu and between Zangfu and disease factors in the origins of patterns of disharmony. Chapter 15 dealt with the interrelationship between emotional disharmony, Zangfu disharmony, and the origins of disease. This chapter investigated disharmonies involving pairs of Zang, and then combinations of three or more Zang, and progressed to 4 examples of common disease patterns. The next stage is the study of individual case histories to see what actually occurs in practice. To understand the method and techniques applied in the case histories, first, we must briefly consider the topics of diagnosis, treatment, and patient education, the subject of the next chapter.